Hi, my name is Tate Simmons, and I am your mom's student physical therapist. I've been working with her for about a week now, and she said you have some questions for me. Okay. Yeah, so your mom did have a total hip replacement, and we did see that the doctor chose the post lateral option, which just means that her scar and incision to where they did the surgery was a little bit more on the back side of her hip area. Yeah, it does come with just some different precautions as well. So some precautions for that post-lateral incision would be we don't want her doing any hip flexion greater than 90 degrees. So that would be like lifting her knee up really high or bending forward to pick things up off the ground or tie her shoes. And also when she's sitting, we want to make sure that her knees are lower than her waist. So that'll keep that, keep that trunk to top of the leg ratio pretty wide. So we don't want her to be anywhere past this from the top of her legs to her where her stomach is. So definitely having any raised seats or stuff like that would be really important because it will help keep that good angle that we're looking for. We also don't want her doing any internal rotation, so it's going to be kind of like pigeon toe. So that'll be where we don't want her sleeping or sleeping with her feet turned in or turning with her feet turned in when she's walking and different things like that. Also, when she's sleeping, we want to make sure that she doesn't take that leg across the middle of the body. So we call it adduction. So we don't want to bring that leg anywhere past the midline. So, no standing up while legs are crossed, no sitting with her legs crossed. That just really protects that, that hip joint that they worked on. So, yeah. So in therapy, we're going to be doing a lot of strengthening of those supporting muscles of that hip. So it's going to be, the muscles that are on the front, on the side, on the back side of that hip, especially in the bum area. We'll be working on some leg lifts and some marches and, working on exercises for her bum. We'll be doing a lot of where she'll take her leg and she'll pull it away from her body and bring it back in, but again, not past that midline. And then of course, sitting up and standing and sitting back down into her seats. So we want to make sure we're really getting her to understand how to protect that hip with all those precautions. Normally with total hip replacements, we start with exercises on the table and then we progress them either with a resistance band or get them standing up and have them do exercises while they're standing. Yeah, that entirely depends on her. So if she continues to work hard for us, which she's been working really hard this past week, and following those precautions that, she does all day, every day, then, I don't see how that wouldn't only help aid and speed her recovery up quicker to make her recovery faster. And I can't give you a definite date on when she would go home. Again, that entirely depends on how hard she wants to work. We do have some therapy goals. I see already this week she's reached 3 of those early therapy goals, which is super great. And again, with the continued hard work and just working to achieve those therapy goals, both here and at home, that really will help speed up that recovery process and also get her feeling good and confident to go home by herself. Yeah, it was great talking with you. And like I said, if you have any more questions, please feel free to ask me. And, if you are understanding something, we can definitely get something figured out to where you both are understanding what needs to happen. I appreciate it. Have a good day.